Pembrolizumab for melanoma treatment. Our immune system acts like a security checkpoint at the airport. It's like a high-tech full body scanner system protecting us from harmful substances. In the immune system, the T cells have receptors that allow them to scan and distinguish between normal and abnormal cancerous cells. Once detected, T cells attack and remove the cancerous cells. However, not all cancerous cells are detected. One of the many ways that cancer cells get past the security system is with the help of a molecule called programmed death ligand 1, also known as PDL1. It is found on the surface of cancer cells and is almost like a disguise that allows cancer cells to remain undetected. Basically, it hacks the scanning system by jamming the signal to parts of the T cell system called cell death receptor, PD1. Think of PD1 as a sensor that's a part of the T cell scanning system. When this is blocked, it does not allow the T cell to sense the cancerous cells and hence is unable to destroy it. One specific type of cancerous cell with the PDL1 receptor is melanoma. Melanoma has the highest death rate of all dermatological cancers. In Australia, we have the highest incident rate of melanoma worldwide, resulting in over 5,900 diagnoses and 1,700 deaths annually. Although historically, melanoma has been difficult to treat at advanced stages, new emerging therapies are providing promising therapeutic options. Pembrolizumab is a humanized monoclonal antibody that works by inhibiting the PD1 receptor from binding to its ligand. The blockage of PD1 and PDL1 pathway allows T cells to recognize and thus kill cancerous cells by releasing cytotoxic cells. Pembrolizumab has been assessed in a number of clinical trials. In 2015, Melanoma Institute Australia accomplished a world-first study that found pembrolizumab's anti-PD1 antibody increases the survival of patients with advanced melanoma. It recorded a 1-year survival rate of 74%, which is more than double the survival rate in 2009, which was 30%. A phase 1 non-randomized trial of 135 patients that had advanced melanoma were given pembrolizumab 10 mg per kilo every 2 weeks or 3 weeks, or 2 mg per kilogram every 3 weeks. Across all dosages, 35% of patients who could be evaluated had confirmed response to treatment. The estimated median progression-free survival was over 7 months. The efficacy of pembrolizumab in phase 1 trial seemed to be independent of the dose. A randomized phase 3 trial compared pembrolizumab to ipilimumab for advanced melanoma patients. Pembrolizumab reduced the risk of dying by 31% compared to ipilimumab. It reduced the size of tumors for 33% of patients compared to ipilimumab, which was only 12%. It reduced the risk of cancer spreading, growing, or getting worse by 42% compared to ipilimumab. The median progression-free survival rate was 4.1 months for pembrolizumab compared to 2.8 months for ipilimumab. When comparing the adverse effects, less than 15% of patients taking pembrolizumab show signs of adverse effects compared to 75% for ipilimumab. Pembrolizumab has proven to be much more effective and safer than the majority of other treatments. Despite the promising results, it also has shortcomings. These include adverse reactions such as pneumonitis, colitis, hepatitis, and nephritis, as well as type 1 diabetes, hyperthyroidism, and hypothyroidism. Pembrolizumab also can't be used for pregnant women, since it is a Category D drug. Pembrolizumab is also very expensive. According to the World Health Organization, the average cost per patient who administered 2 milligrams every 3 weeks is $8,764 per dose, or $145,000 a year. The existence of the drug has the ability to create a strong socioeconomic divide between those who can afford it and those who cannot. Individuals who can't afford it are placed under extreme stress to either increase their debt in order to live or succumb to other methods of cancer treatment which may not be as effective. Patients using pembrolizumab still exhibit symptoms of pain, exhaustion, insomnia, diarrhea, and coughing, which is no different to other cancer treatments. Further research is required to improve the efficacy while reduce the complications associated with pembrolizumab in the treatment of melanoma.